My name is Jack Placchi. I live in Golden, Colorado. I have degenerative discs, my lower lumbar. I had one disc bone on bone, another just about there, and then I had narrowing of the nerve cavity on the other level.
I first met Jack here at the Golden office, and he's a pretty outdoor kind of guy. And he was really limited in his outdoor activities. He loved hiking, biking, all the things in Colorado we love to do. And he had been putting up with his symptoms for quite some time.
The struggle was trying to figure out how to deal with it. First I did pain management, did physical therapy. I kept trying different things. After about a year and a half, it kept getting worse. And I started getting bursitis kicking in, and then I was having a hard time just walking. I was limping, and so I went back to talk to Dr. Loutzenhiser, went over all the x-rays thoroughly and talked about it a lot more, and I thought I got to do something, so I decided to do the surgery.
Traditional open spine surgery has been performed successfully for years. Minimally invasive spine surgery is performed to try to minimize the damage to the tissues while performing the same surgical goals. Some of those benefits include less blood loss, decreased risk of infection, less damage to the muscular support of the spine, and that can help decrease the risk of the next disc up wearing out, which can be a problem with spine surgery. Typical open surgery with 1 or 2 discs probably has a good 6-inch incision or so. A minimally invasive surgery would have 2 incisions, just a little over an inch, inch and a half, one on each side of the spine, one on the left and one on the right. So he had both back and leg symptoms, and the back symptoms can come from the shifting of the bones, or what we call instability of the spine, and the pinched nerves that are occurring as the spinal canal shifts and as the nerves are pinched down low can cause shooting pain, or what we call radicular pain, into the legs, and that can cause pain, numbness, tingling, weakness, cramping, and those sorts of things.
Dr. Loutzenhiser is very thorough. He goes over the x-rays, and he goes into detail what the issues are. He very descriptively tells what he's going to do, how he's going to do it. That made me feel better about the surgery.
Post-operatively, he's got 6 screws, 2 rods, and 2 spacers, and you can see those bones realigned nicely, and you can also see that the bone-on-bone disc that was there before surgery is actually a little taller, and he's got more space there for the nerves behind. So the nerves are decompressed, the spine is more stable, not shifting on him. Hospital stay on average is about 2 nights. I do ask patients to have restrictions for 3 months, and that's no BLT, no bending, no lifting more than 10 pounds, and no twisting.
After 3 months, they said I could start riding my bike easily. After about 6 months, I went for my 6-month checkup, and they released me to do, whatever I wanted. Everything's back to normal. My back feels very stable, like it was when I was in my 20s. It just feels great. When I was done, I was glad I did it. So hopefully it's going to add another 15, 20 years to my cycling.